Hi, I'm Peggy Oliveira. Welcome to Courageous Journeys. May is Mental Health Awareness Month. Did you know that? Mental Health Awareness Month is designed, at least in part or mostly, to help reduce the stigma associated with mental health issues. And in our languaging, we often tend to equate mental health with mental illness, and they're not the same. Mental health is just the state of our mental well-being, our emotional, psychological well-being. And we can have really good mental health, and we can have mental health that needs a lot of support, needs a lot of healing, just like our physical health. We might be in great physical shape and things are running very smoothly, or we may, through either a chronic condition or an injury, may need resources to help heal or manage that. So in terms of reducing stigma, one of the most significant things we can do is stop equating mental health with mental illness, recognizing that they are not the same. Also recognizing that mental illness can mean different things to different people, and that's part of the difficulty. And so mental illness is generally connected to a mental health diagnosis. So something that ideally a mental health professional would give you, but medical doctors often give diagnoses as well, even though they're not really trained in mental health, which is also part of the difficulty. But a mental illness is typically diagnosed by a mental health professional. It's often treated with medication, which is also another problem. I think that I want to be clear, and I've said this many times, I think that there are times when medication is completely appropriate, beneficial, and needed for different types of emotional or psychological problems that people are having. So I'm absolutely not opposed to medication. What I am opposed to is a quick diagnosis without looking at the whole picture and then just immediately treating those symptoms with medication. And that's really kind of part of what I'm talking about today, is that when we equate those things, then we're kind of furthering how we as a society view mental health. And the reality is that as a thinking, feeling human being, we're going to struggle at times, emotionally, psychologically. Life can be hard. Relationships are challenging. This past year, over a year now, has shown how much something can really throw us off and impact us. And one of the reasons I believe that we have been kind of globally affected so much, why people are talking so much about the psychological impact, the trauma even of COVID-19, is because it has been traumatic, I think, for a lot of people. But one of the reasons for that is that people were already struggling, whether they were consciously aware of it or willing to acknowledge it or not. And the less willing we are to acknowledge it, the less able we are to recognize that there is something going on there, the more impacted we are by subsequent things that happen. And so being able to look at what is that underlying thing is important. And if we can look at that without immediately diagnosing somebody with mental illness, giving them a diagnosis, the better off we all are. The better off that individual is, because we can look at what is actually going on here instead of just labeling them with a diagnosis. And so, for example, in my own practice, I have worked with so many people over the years that have been given a diagnosis of varying things. Certainly depression and anxiety, PTSD, bipolar disorder is a big one. And I even years ago had somebody that had been diagnosed with schizoaffective disorder. It's a really significant diagnosis. That's not something you can heal from. That is a chronic mental health issue that you can work to manage, but it's not something that they see as treatable other than symptom management. And the reality is that the medical model, which is physicians, psychiatrists, and even many therapists, are trained under that medical model. And so you have somebody come in who tells you what's going on for them, how they're struggling, and they're given a diagnosis. And then this is the protocol that we use to treat this diagnosis. Now, fortunately in the mental health field, that's beginning to shift ever so slightly. But it is beginning to change, fortunately. But far too often, even now, somebody who has experienced childhood trauma will go to see somebody, or, well, they'll go to see somebody, family physician, therapist, psychiatrist, and will share that they have a history of childhood trauma, which is good. That's important. But unfortunately, they are immediately given a diagnosis that may or may not be completely accurate. And with that diagnosis comes a protocol of treatment. And as I said, much of the time that includes medication. And again, medication may be important, but what often happens is that you're given a prescription for medication, maybe suggested to go to therapy, and you're kind of on your way, and then you just go back every once in a while to get a refill of your medication. Well, the truth is that childhood trauma isn't something that you just manage. Childhood trauma is something that you can heal. It's not easy. It takes a lot of time and effort on your part, as well as the person supporting you, ideally a clinician trained and experienced in childhood trauma. It's work. There's no doubt about that. But it can happen. But what traditionally has happened is you're given the diagnosis, you're given medication, or maybe you even go to therapy, but the therapeutic process tends to be focused on the symptoms, reducing the symptoms. And that can help for a while. Even just talking about it, if you've never talked about it before, having the support of that person listening, that can be a tremendous benefit. But it only lasts so long because the impact is still there. So it takes work, but healing is possible. But when we as a profession, when we as a society look at it as something that is kind of a permanent state, it can leave people feeling pretty hopeless. Now, on the flip side of that, and I've talked about this before too, so if you've watched a lot of my videos, you've heard me talk about this, but I think that this is important to talk about here as well. So on the flip side, over these last several years, again, particularly with the Me Too movement, the most recent Me Too movement, has been kind of everybody seeming to be like an expert in trauma. And we have to be really careful of that as well, because while not everybody fits a specific diagnosis and needs inpatient hospitalization, it is a very serious, complicated, incredibly complex issue that takes a lot of understanding and experience to really know how to work with. So we don't want to go to either end, far end of that spectrum. I mentioned just a little bit ago about the diagnoses, and I want to spend some time talking about that. So again, before I start on this, I want to be clear. I think that there is a time and a place for a diagnosis. I think that there can be benefit in that for a variety of reasons. But I just want us to be really conscious and cautious of either giving that diagnosis or receiving that diagnosis. So, for example, the person that had been diagnosed with schizoaffective disorder, she was given that diagnosis because she shared, and I can't remember at this point whether it was with her physician or a psychiatrist, she had shared that sometimes when she's out and about, particularly in a large crowd, she will sometimes hear or think that she might hear her mother, like calling her name. And when she told me about this, I had already known that her mother kind of was missing, and her mother had been homeless off and on at different times. She'd be homeless for a while, she wouldn't hear from her for a while, and then suddenly she'd show up again. And so her mother struggled with mental illness. So her mother would kind of come and go, and she was homeless. She never really knew where she was. She would never know when she would show up. And so on occasion she would think that she might have heard her mother's voice calling her. So when she shared this with whoever it was that she was seeing, they diagnosed her with schizoaffective disorder, that she was hearing, she was hallucinating things. Well, if you think about that in context, right, it would kind of make sense that she might, on occasion, think that she could hear her mother calling her name, especially when there's a lot of kind of commotion around you or a lot of people talking around you. Her mother has just randomly shown up before out of the blue. It's not really a mental illness. It's kind of a normal reaction, a normal experience actually that she had had, but yet she had been diagnosed with a pretty significant mental health disorder and put on medication as a result of that. I've had numerous people diagnosed with bipolar disorder, and for a while that was like the diagnosis du jour, so to speak. Seemed like everybody was being diagnosed with bipolar disorder. But something as simple as going to your physician and saying, there are times that I can just so easily be angry, and I can really just kind of flip out at somebody, or I can be going along pretty well, feeling like I'm doing pretty well, and suddenly I feel really depressed again. Well, yes, when you look at the criteria for bipolar disorder, that fits within that. But when you look at the whole context, and you look at things going on in that person's life, you look at the historical aspect of that struggle of anger, depression, doing really good for a period of time, like feeling really on top of things, feeling really motivated, and then they're not. It's easy to look at that and give a diagnosis of bipolar. But when you look at the whole historical context, you look at the wounding, it kind of makes a lot more sense. In fact, that those extremes are part of what people can experience when they're given a diagnosis of borderline personality disorder. which is typically a diagnosis given to women in particular who have had an experience or had experienced childhood sexual trauma. But again, looking at it from the context of childhood trauma or trauma kind of in general, but particularly as a child, there's a lot of that aspect that makes sense. Now, is it healthy? No, of course not. It doesn't feel good to the person experiencing it. And if it's anger or even significant depression, obviously that affects other people too. So it's not healthy, but it doesn't necessarily mean that you need to be diagnosed with something like, or either one actually, bipolar disorder or borderline personality disorder. Because again, both of those things are not things that are seen as kind of curable. They're things that you can treat, but it's more about managing symptoms. Bipolar disorder with medication, borderline personality disorder, really there's not much that they believe treats that. There's different things that you can do to help mitigate some of it, but still not seen as really treatable. So what I want those of you listening to this, because I know that most of you are going to be people that have experienced childhood trauma, struggle with emotional issues, psychological issues, struggle with depression and anxiety, whether it's a clinical diagnosis or not, struggle with relationships, with worthiness, self-doubt, shame. What I want you to take from this is being able to see your struggle as a normal reaction to the kinds of things that you've experienced. Now, I want to be sure to clarify here that normal doesn't necessarily mean healthy. There is a difference there. It's a normal reaction, a normal response to what you've experienced. It can still be unhealthy. If it's creating difficulty for you, it's likely unhealthy. But unhealthy doesn't have anything to do with who you are as a human being. It has nothing to do with being weak. It has nothing to do with your capacity to heal. It just means that the way that you have coped, the way that you have responded to that is normal, but it's creating difficulty for you, which is why you're watching me in the first place, right? And so with that, recognizing that it's normal, that there are things that you can do to heal, can help you maybe seek out somebody to help you heal, but it can also help you recognize that there isn't really anything wrong with you. Just like the process of grief is a normal process of loss, of dealing with loss. There's no one way to move through grief. Grief can create difficulty. Grief, if you're really kind of in that phase of denial or anger, it can create some challenging circumstances. You might completely shut yourself off from everybody and become kind of depressed. You might be really struggling with accepting this loss. You might blame yourself in some way, and that can create a lot of issues around anger. It might not be healthy. It might not show up in healthy ways, but it doesn't mean that you're mentally ill. It does mean that there's something to work on there. It does mean that maybe you need support to help you through that. There's absolutely no shame in that. In fact, ideally, I think that grief is something that we should have support with, because we're not taught that, well, how to grieve. In fact, for the most part, we're taught that we deal with loss by picking ourselves up and moving forward. And that's not a really healthy way to grieve, which is why so many people struggle with grief. So recognizing that there is nothing wrong with you. There is nothing inherently or deeply wrong with you, but there is something that may need to be healed. If you're struggling with how you feel about who you are or how you show up in the world, how you react and respond to difficulties that come up, whether you end up feeling really depressed and suicidal, or you become really angry or avoidant and use substances or behaviors to completely avoid what's going on, none of that serves you well. None of that helps you heal. But that doesn't mean that there's something wrong with you. So as we think about destigmatizing mental health issues, recognizing that struggle is a normal part of being a thinking and feeling human. It just is. Like, everybody is dealing with the ramifications of COVID, even if you've not personally been affected by it. It's affected our lives. It's something that we have no control over. We don't have control over the people around us who haven't taken it seriously. And if you're somebody who is practicing the things that the scientists are suggesting, but the people around you are not having control over that is quite challenging. It can feel very unsafe, and for childhood trauma survivors, there's a lot that feels familiar about that. And again, that doesn't mean that you need to be labeled with a diagnosis because you're struggling with that. It's a pretty normal reaction. Even if it doesn't require a diagnosis, it is important to acknowledge it. It's important to honor the reality of what's coming up for you so that you can work through it. You don't have to deal with it on your own, and you absolutely don't have to be ashamed that you're struggling. There's nothing to be ashamed of. We've all struggled through this time. There is no way that you can experience trauma at any age, but especially childhood trauma. There is no way that you can experience trauma and not be affected by it. You just can't be expected to not be affected by it. So, normal reactions, even if not healthy, does not mean that there's something really wrong with you. It doesn't even mean that you necessarily have a mental illness. So please try to keep that in mind. The ongoing struggle that you have, even when you've maybe been to therapy or done these different types of techniques and read all the self-help and done all these things, it's not because of you. It's not because you are beyond help, hope, or healing. It's because you haven't yet gotten the healing that you need. You haven't yet maybe gotten the type of support that you really need with a type of professional that really deeply understands what it means to be a childhood trauma survivor. There is nothing wrong with you. You are experiencing the normal reactions and impact of what it means to be a trauma survivor. But that also means that there is healing for you to do. It doesn't mean you have to just learn to live with it. It doesn't mean that at all. So I'd really love to hear from you in the comments. What have been some of the things that you've believed about your experience in terms of what you just have to learn to live with? Maybe you've been given a diagnosis. Maybe you've been diagnosed with borderline personality disorder, which I've said this before, but I don't personally believe in that as a diagnosis. I think it's a way to just put people that are that struggle in a lot of ways and don't respond to the protocols laid out. It's kind of a way to categorize them as, okay, that's what these people are. And in fact, I looked up a little bit about Mental Health Awareness Month, and there was a little thing that came up that said, what's the most difficult mental illness to treat, or something along that line? And it said borderline personality disorder. I shouldn't be surprised, and I guess I'm not really surprised, but I'm disappointed. I'm disheartened by that. In part, again, because I don't really believe in it as a diagnosis. And it is, in all reality, something that both those in the mental health field and those given the diagnosis kind of feel, kind of are left feeling hopeless, that there's really much that can be done about it. And that makes me sad. You yourself may have been diagnosed with borderline personality disorder, or you may know somebody who has. There's a reason that the majority of people diagnosed with that are childhood trauma survivors, in particular sexual abuse. And the reason, there's two parts to it. The reason is it has become kind of synonymous. So somebody hears childhood trauma or sexual abuse, and immediately that's the label that's given to them. And the truth is that as a childhood sexual abuse survivor, you do struggle with relationships. You struggle with trust. You struggle with a push and pull of wanting to connect with people, but also experiencing that the people closest to you are the people that can hurt you the most. There's going to be push and pull. You know, the book, I Hate You, Don't Leave Me. Like, think about that. I hate you. You can hate somebody because the opposite of love is not hate. You can only hate somebody when there is some sort of an attachment there. The opposite of love is indifference. So you hate somebody when you've been hurt by somebody. Or when you witness the hurt caused by somebody. I hate you, don't leave me. You hurt me, but please don't go. You hurt me, but I'm terrified you're going to leave. Struggling with that push and pull, struggling with trust, struggling with the ends of the spectrum of feeling good, and then suddenly there's something that reminds you of your belief that you're unworthy. That's a normal reaction. It isn't a personality disorder. It's not, in and of itself, it's not bipolar disorder. And I don't want you just automatically, if you've ever been given a diagnosis, I don't want you to automatically just completely discount that. But I think it's something that's important for you to have in your mind, that maybe your struggle is directly related to childhood trauma or to something that has created that. As a social worker, one of the aspects, one of the core tenets of our profession, no matter what area of social work you go into, whether it's mental health or casework or administration, whatever aspect of social work you go into, one of the core tenets is looking at your client, whatever that client is, looking at that client as somebody within the context of a larger environment. It's called person in environment. So you look at that person and whatever is going on around them, drug addiction, homelessness, emotional or mental health issues, whatever it is, you look at them, prisoners in the prison system, you look at them in the context, in the whole context of their environment. Because it's everything within that environment that affects how they show up with you in that moment, how they show up in every moment of their life. And when you look at somebody in that context, you don't just immediately jump to a diagnosis. You don't immediately write them off. You look at them from a more holistic perspective, from an understanding of that whole, and getting back to the idea of reducing stigma. That is one of the most significant ways that we can do that. And we can start with how we view ourselves. Look at the language that you use to describe yourself. You are not weak. You are not damaged. You are not beyond hope. You're not bad. You're human, responding in a human way to what you've experienced. Thinking about COVID, we are all human, responding in human ways to a global pandemic that has changed most everything that we've gotten accustomed to. Yes, some people, it feels a lot more familiar. It brings up a lot more than it may for other people. But it's still a normal reaction for somebody who has experienced any of those other things. So, I'd love to hear from you. Share your thoughts, your comments, your experiences. We have the power to reduce the stigma by talking, by being open in what we share and what we hear, by questioning when we hear about somebody with a diagnosis, even if in our own mind. Having that awareness that things may not always be the way that we immediately look at them. And if you happen to be somebody in the mental health field, thinking of that too. That much of the time, a childhood trauma survivor isn't going to share immediately that they are. When I was in private practice, while I specialized in childhood sexual abuse, I saw people with other issues on occasion as well. And I had many people that would come to me, and even though it was on my initial paperwork, I asked if they had ever experienced child abuse, or I don't remember exactly how I worded it, but I had many people who initially said no. And then later, as they felt a little safer, shared that they were in fact a survivor. So being able to recognize that is important. Thank you for watching. This went a little longer than I expected it to. I hope that you can begin to see yourself and maybe those around you, but mostly yourself, because if you're watching this, you've probably been struggling with it, with a little bit more understanding, a little bit more self-compassion. Thank you for watching. I look forward to seeing you next time.